Ladies and gentlemen, welcome to the Bariatric Health Podcast, where we're going to explore the latest advancements in the world of weight loss surgery. I am your host, Dani Mahsin, today, and I have with me in the studio a distinguished surgeon who has a long expertise in the bariatric field. Actually, he has a fellowship from the Netherlands. He is a certified surgeon of excellence by the IFSO, the International Federation for Bariatric Surgery. He has 30 plus years of experience in surgical field and 20 years of experience in bariatrics. Actually, he was one of the pioneers who introduced bariatrics to the UAE. He worked in multiple hospitals in the UAE, and he was the head of surgery in Al Zahra Hospital from 2016 until 2023. Today, he is in Gargash Hospital, in Emirates Jumeirah, and in Swift Day Surgery in Jumeirah also. Welcome with me, Dr. Girish Juneja, today in the studio. Welcome, Dr. Girish.
Thanks, Dani.
We are very happy to have you here. Thank you for sparing the time.
Me too, happy to for your invitation and joining you here in the podcast.
Thank you very much. Actually, we are exploring today the world of bariatrics with you. People do not know much about bariatric surgeries and weight loss. You will be introducing us to this whole world of myth, if I can say, because there is a lot of myth around the bariatric surgeries. I will start my first question with you. What is bariatric surgeries and what are the types of bariatric surgeries available today?
See, bariatric surgery or bariatrics means dealing with your weight. Once you cross weight or you become obese, which brings a lot of problems in the body, which we'll discuss down the line, to correct those problems and to bring your weight back to near normal or normal, the procedures which are done is called bariatric surgery. That's a simple explanation for bariatrics.
Okay, so it's a procedure done to reduce the weight of a person and get him back to a healthy weight.
Healthy weight and healthy lifestyle.
Healthy lifestyle.
Yeah. So procedures which you were asking, there are multiple kinds of procedures. We can divide into three parts. One is surgery itself. Number two is non-surgical procedures. And there's one in between endoscopic procedure, mandar. In Arabic, we say.
Indeed.
So, non-surgical procedures which are famous is gastric balloons, swallowable capsule like Aluron, or endoscopic balloons, quick procedures. You can lose 10 to 15% of your body weight. Endoscopic procedure is called endoscopic sleeve gastroplasty or ESG. Through endoscope, without cutting, we put stitches and make the stomach smaller. You can lose 15 to 20% of your body weight. In 3 to 6 months. Now coming to the bariatric surgery proper. There are multiple kinds of procedures. It's done through laparoscope, keyhole surgery, or robotic. The most common and most popular surgery is called sleeve gastrectomy, in which we reduce the size of the stomach by cutting stomach, of course, surgeon's job. And then is called gastric bypass. There's a mini gastric bypass, there's Roux-en-Y gastric bypass. Different medical terms are there.
Gastric bypass is known by the public when you remove the total stomach, right?
No. So we create a smaller stomach out of your main stomach. And we connect it to the part of the intestine about 1.5 meter or more away from the main root. So your food, you eat food less because stomach is smaller.
Of course.
The rest of the part of the stomach stays in your body. But the absorption starts after bypassing a loop of intestine. That's why it's called bypass. It bypasses a loop of intestine. So despite you eat, you absorb less. It's called malabsorption, which has its own side effects also. So this is gastric bypass. In sleeve, we cut the stomach almost 60-70%. And that goes out of your body, and we make a new stomach for you, which is smaller, like a banana shape. That's why it's called.
It takes less food.
Like a sleeve, it's called sleeve.
Oh, that's why.
Yeah.
This is where the name denomination
Before
comes.
stomach's big, and then later on it's more like a small
sleeve.
It's called sleeve gastrectomy. So these are the most popular procedures and very effective, not only for weight loss. See, the myth is that bariatric is for weight loss. No. When you gain weight, you develop a lot of problems, like you can say metabolic problems like diabetes, hypertension, snorings, sleep apnea, PCOS or polycystic ovarian in females, mechanical problems like back pain, knee pain, breathlessness of walking. So all these things are induced by weight gain. When we reduce weight, they disappear from the body. I can make diabetic people non-diabetic. Means reversal, we can do it. So this is the biggest advantage of bariatric surgery, and is called metabolic benefit of bariatric surgery.
So bariatric is mostly getting the person to being healthy again, not only weight loss, because in the people conception, it's only weight loss, you know?
Yeah. You summarize very well. Bring back weight to near normal or normal, and all the associated problems in your body because of obesity, reverse it.
If I ask you, how does a patient become a candidate for bariatric surgery?
There are some criteria. The first criteria is that body mass index is a gross which gives you idea whether you qualify for bariatric surgery or not.
Okay.
Normally up to 25. Weight in kilograms, if you divide by height in square meter, whatever number will come,
Okay.
that is
This
your
is the
body
BMI.
mass index.
Yeah. Okay.
So up to 25 is normal. Once you cross 25, then the problem starts.
Okay.
So surgery, we advise BMI 35 onwards, or between 30 to 35 if you develop two comorbidities like diabetes, hypertension, sleep apnea, cholesterol problems, heart disease, then you qualify for bariatric surgery.
So the high weight has to be accompanied by a health problem.
Between 30 to 35.
Okay.
Above 35?
Khalas, you go for the
You go
surgery
for
directly.
Yeah.
Okay.
These are the latest guidelines from American Society of Bariatric Surgery,
I see.
ASMBS.
Okay.
Now, suppose this is surgery. Somebody doesn't want surgery. Whether he doesn't qualify for surgery, but he is overweight, what you do? 27 body mass index to 30, 32, 35. Then we advise non-surgical
Okay.
or endoscopic.
Okay.
Gastric balloon or ESG, endoscopic sleeve gastroplasty.
And it gives the exact same effect as the
No,
surgery?
it's not effective. Nothing can be effective like
Bariatric
surgery. Yeah.
Okay.
But you don't qualify for bariatric surgery, but you have overweight, I'm having problems. So why don't you take
helps
advantage
reduce
of
it.
these? So it reverses back also.
Okay. What are the pre-surgery evaluations that you do or requirements?
For surgery, since I am a surgeon of excellence in bariatrics,
Okay.
so we follow all the path guidelines to make surgery very safe and very effective. So in my center, what I do, we do the, of course, after height, body, BMI and those kind of things, we do basic blood test to know currently what problems are in your body, which 30% of my patients in the clinic, they are not aware. And we find diabetes in them, cholesterol in them, a lot of problems we find. So first is screening. Then we send to my team, which is having endocrinologist, pulmonologist to check your chest. A lot of people have sleep apnea.
Yeah, indeed.
And then to the cardiologist.
Okay.
Once they declare that patient is fit for surgery, we send them to dietitian to prepare. So this full teamwork is there. Not that today patient comes and next week I'm operating it. So there's a process from this. All reports comes back to me. We discuss with the patient once again, discuss with the proper procedure, complications, what you can expect now and after 1 year or after 5 years. And then we subject to the surgery. So this is the pre-operative preparations, and then we tell them our diet and all that. So it's an extensive preparation to make surgery effective and safe.
Just to summarize for our viewers now, the options that someone has in case he is overweight and suffering from health conditions. Okay, he has a BMI above 25, as we said, and sometimes there is a bracket between 27, you said, to 30 or 35, was it?
35.
So 35, some procedures should be taken, and above 35, he qualifies for something else. So just to summarize, the options that someone has are, you said sleeve?
In surgery, sleeve.
Okay. Bypass?
Bypass, mini bypass, or Roux-en-Y bypass.
Okay.
These are the most common ones.
Okay.
And then there are minor other things are also there, but these are the most popular and most common.
Okay. What does the surgery involve? In case we're talking about surgeries here, what does it involve? And what does the patient have to expect from the surgery or directly after the surgery?
See, recovery after laparoscopic surgery takes time, about 1 week. You can join back your job. Exercise you can start after 4 weeks. Walking from day one. This is after that. And diet, after surgery, 2 weeks of liquid diet you have to be, and then 1 week soft, and then from fourth week onwards, normal diet. This you expect after surgery. Surgery, usually I tell my patients so that they will remember. 1 hour surgery, 1 night in the hospital, 1 year my team will follow. So
Okay.
1, 1, 1.
So it's only one night in the hospital.
Yes.
That short.
That
for
short.
something that big. Yeah.
And I'm trying to make it as a day surgery.
Okay.
We are having a plan. We are preparing it. Selected cases, I might send them home by evening,
Same day.
same day.
Walk in, walk out, same day.
Yeah.
What are the techniques you are currently using in whether in Swift Day surgery or in Gargash Hospital? I heard you have special techniques.
Yeah. The routine surgeries and techniques we were doing it. About 2 months back, for sleep, which is the most popular surgery for weight loss and metabolic complications. It's called sleep surgery, in which I told we reduce the size of the stomach. We cut it.
Indeed.
So till now, we were using multiple staplers.
Okay.
To cut stomach, we use staples. And now the staplers, the longest stapler was available was 60 millimeter or 6 centimeter. Stomach is more than 20 centimeters. So we used to fire at least 4, 5 or 6 staplers. So nurse will load, will give it to me, I will fire, then I'll give back the gun, and then she will load again, I will fire. So whenever the two staples, where they meet, there will be hand movement and connections between two staples, zigzag will be there.
Okay.
Now I have introduced, is getting very popular in USA, and it's called single fire stapler. So no need for multiples. We load one, it's long, and it cuts reverse way, not from down to up. Till now we were doing that.
Okay.
From top to bottom. It cuts the stomach in 55 seconds and is controlled through the robotic machine. So more precise, more quick, short duration of surgery, short anesthesia surgery leads to faster recovery, less chances of GERD or acidity or nausea, vomiting, and the shape of the stomach is smooth, very nice.
This is the technique you were telling me before the shooting that you have the exclusivity for in Dubai.
Yes, yes.
Right.
I'm
So you are the only one executing this technique in Dubai, right?
Yeah. You can say that if somebody wants to have a surgery using this stapler in Dubai, has to come to me.
Okay. Yeah. Okay. So, ladies and gentlemen, if you want to use this technique, you have to come to Dr. Girish. Here we are introducing him to you. All right. What are the complications expected after a surgery? The potential complications, surgery like this?
So, any kind of bariatric surgery, we can say that 1% of chances of complications are there theoretically. 99%. See, you have to choose an expert surgeon, a good hospital. This combination reduces chances of complication to 1%. Now, out of 1%, there are two kinds of complications, specific to this surgery and non-specific. Non-specific means like you do any surgery.
And
any
there
kind
might
of
be
surgery.
complications.
There might be
course.
complications like bleeding, infection.
Indeed.
Number two, being overweight, you are prone to develop blood clot, jalta.
Yes.
You are prone to develop it. Even if a person without surgery takes a travel of long travel like 6 hours, doesn't move much, doesn't drink much water, can develop blood clot because they are so much prone to develop it. So what we do after surgery, we give them blood thinner injection once a day like insulin, not insulin, like insulin. So that 1 week you take it, 1 to 2 weeks, depending upon your weight and all, and that prevents it. Now coming to the specific complication to this surgery. Number one is leak.
Okay.
We are cutting the stomach. We are putting staple. We are putting stitches. They might break or they might leak out. So how we make it? It should not happen because this is the dreaded complication.
Of course.
So we use staple, which are good quality, excellent quality, not, sorry to say, Chinese or those kind of things.
Yeah.
And 3 rows of staples are there. So
Okay.
if something happens to one row, second is backup, then third is backup. Then the surgeon, a good surgeon, will close and check under live conditions, means distend the stomach and check. Everything is okay, we close.
Okay.
My patients, next day I do extra test, send them to X-ray, they drink, we see the new stomach, and the drink goes like food. So we can see the whole, no leak, nothing is coming up. I'm sure that patient can go home. I send them home.
Okay.
By the way, I want to share with you that in my whole life, very few bariatric surgeons are there who have zero complication rate. I'm one of them.
That's good to know.
I feel
This
proud
is very
also.
important. Yeah.
So you have to be good team, very specific, take care of what you call all the instruments, quality staplers, that will lead to zero leak complications.
Coming back to the new technology you spoke about, you said that this technology by itself, it minimizes the number of potential or possible complications, right?
Yes.
In terms of what exactly?
Yeah, I told you recovery is faster. The smooth outline of the stomach, like a natural
And this is
stomach,
very important.
Very important.
Yeah.
And then the jigsaw between two staples is gone. Because 6 staples you use, 6 points jigsaw is there.
Exactly.
It is a smooth one. So that goes out. Post-operative nausea, vomiting is less. Chances of GERD is less. GERD means post-sleeve acidity.
Yes.
And this is meant for sleeve only, not for bypass.
And this technique, you are using it everywhere, like in Gargash Hospital, in Swift Day Surgery, and everywhere, right?
Exactly. Now I'm offering to my patients that this month we have around 8 or 9 patients booked, and to my surprise, when I explained them, all opted or shifted to this new stapler.
Excellent.
It's becoming popular.
Yeah, of course, if it has better results, so why not?
Better, yes, yeah.
I want to ask you about the typical recovery process after bariatric surgery. What is the typical recovery process for a patient?
Yeah. See, as I told you, 2 weeks you will be on liquid diet. First week, naturally, you are on liquid diet. You might feel a little bit nausea or a little bit weakness and those kind of things. You take rest at home. After 1 week, I see my patients. If everything is okay, I tell them they can join their work back.
Okay, so in 1 week, they can go back to their normal life.
Yeah. If you're working from home, hybrid, thanks to COVID, now a lot of people are working from home, advantage of COVID, you can start from the very next day.
The weight loss for people, does it differ from one person to another?
Exactly. Every person is different.
Okay.
Genetically also. So the weight loss also differs. But overall, 60 to 70% of excess weight comes down within 3 to 6 months. Now, weight loss is not always straight line down. Today, 50, then 49, then 50, 45. No.
How does it happen?
It comes down and then stops.
Okay. After how long? Is there an average period?
No average. Now you lose, and then after 2-3 weeks you plateau out. Then you do exercise, then starts again.
Okay.
Like I say, staircase pattern.
I see.
Not a straight down.
Indeed.
Straight down is not good.
Yeah, of course.
It will make you very weak.
Of course.
So slow and steady. Within 3 to 6 months, you lose 60 to 70% of your excess weight.
And this loss is a loss of fat. Is it a loss of fat? Because some people are worried that they might lose muscle as well.
Yeah.
Or water from the body.
Yeah. 90% of fat you will lose.
Okay.
10% muscle mass you can lose. Okay. But if you do exercise, you can make fat loss 100%.
Okay.
No muscle loss. And you should be doing exercise post-surgery to give a better good shape of your body so that nobody knows that you even had a surgery.
This is what I wanted to ask you about. Like after the bariatric surgery, is there a lifestyle change that people should go through?
Yeah. 2 things. If you take care, excellent results you get from the surgery. And your body shape is excellent also. Nobody can comment that you had a surgery. There are 2 things. One is healthy eating, no dieting.
Okay.
No,
just no extra fat.
Don't suffer from dieting and attempts, those kind of things. Eat as much as you can eat multiple times, small amount.
Okay.
You will feel full. Portion size will come down for sure after surgery. So eat healthy, eat slow. I always say, everybody is eating very fast now,
Indeed.
gulping.
This
And
is the lifestyle nowadays.
lifestyle.
Life became so fast.
But stomach takes time to relay sensation to the brain that enough food is there. If you eat faster, you will eat double. So eat slow, chew well, eat healthy, of course. Number 2, do exercise of your choice for 5 days a week. 2 days, take rest. Now, what exercise? Can be swimming, can be gym. You don't want gym, you don't want swimming, you don't have time, you are lazy, or you are not tuned to that. Simple walk. 40 minutes a day, 5 days a week. Along with eat slow, eat healthy. You keep these 2 things, the whole life you will keep excess weight away.
What about heavy weights for those who go to gym? Are they allowed to have?
After 4 weeks, you go to gym.
Okay.
After 6 weeks, you can do even kickboxing.
No problem. Khalas.
Even kickboxing,
Back to normal.
no problem. Back to normal.
Okay.
Or very slowly within 2 to 3 months, I think you will be better than most of the people.
How many meals usually a person takes after bariatric surgery? Because you told me the number of meals should be more, but smaller portions, right?
Yeah.
The average number
Because
of
stomach is small, so the smaller portion will make you full, like the bigger portion now makes you full.
Okay.
You will not feel anything, but you might feel hunger after some time. Again, take this portion till you feel, but eat slow, eat healthy. That's it.
Okay. And you can have protein, protein and carbs and everything normally?
You can have it, but we advise during weight loss, high protein, low carb, low fat.
Okay.
See, there is a myth about this. Carb and fat is necessary for your body. But of course, during this part, because you had excess weight, so high protein is needed. Later on, keep to this diet, stick to this diet, you are healthy forever.
Is there a percentage of the weight that can be lost, like final result, as a final result of the bariatric surgery? Is there a common percentage of the weight that should be lost? Or is it different from one person to another?
Most of the people, 60 to 70% of excess weight
Is lost.
is lost
Okay.
in 3 to 6 months. And if you do exercise and eat healthy, you can lose 80, 90 or even 100%. You can come back to 25 BMI.
20.
Lots of my patients, they have reached within 3 to 6 months 25 BMI.
Okay. Some people are worried about the excess of skin, the stretched skin.
Yeah.
What do you advise in these cases?
I will advise that. Before that, I want to tell you one ad.
Yes.
That after bariatric surgery, we advise to take the multivitamins supplement regularly once a day. There are dedicated multivitamins, bariatric multivitamins.
Okay.
So this you take it. Now, coming to your question, if you lose 20, 30, 40 kilograms, skin is bound to get loose. Now, there are 3 places. The forearms, upper arm, and then the tummy, and then on the thighs.
Yeah.
More you lose, the more skin can become loose. Now, to counter it, if you start exercise as we advise after 4 to 6 weeks, for the arms, lift some weights. Thighs, you walk, which I told you, 30, 40 minutes a day. And for tummy, core exercise. So if you start regular exercise, I tell you, lots of my patients, even after losing 30 to 40 kilograms, not 1 inch or centimeter of loose skin is there in all 3 places. But if you are avoiding exercise, you're not doing exercise, most probably on tummy you will have loose skin.
And it can be...
Yes. In my team, there are 2 plastic surgeons.
Okay.
They can remove your extra loose skin and
Come
can
back
make
to
your
normal.
tummy back to normal.
Come back to normal without like major scars or anything.
Major scar.
I want to talk about the benefits and challenges on the long run for someone who had a bariatric surgery. What would you tell us from your experience, please?
Yeah, in long run, you have to keep 2 things. As I told, eat healthy, eat slow. Some exercise. Keep these 2 things. Keep away from smoking and alcohol. If you means overall you have to have a healthy lifestyle. Of course, you can indulge in whatever relaxation you want, but in long run, if you stick to these principles, nothing happens to you, and supplement yourself with multivitamins,
Multivitamins,
which
as you
your
said.
doctor should see.
Lifetime, right?
Yeah,
The
lifetime.
multivitamins.
Yeah, it's better to have lifetime. Yeah.
Okay.
And check your blood test. Be in contact with your bariatric surgeon at least on your birthday once a year.
This is what I want to ask you. Like, how do you monitor and what support do you give for the patients that go through that surgery and in the years following the surgery?
Yeah. Every 3 months, me and my team does a free checkup. I mean the consultation. You have a query, any concern, we take care of that. We tell patients that once a year, at least do your blood test to see everything is okay or not. If any deficiency or something, we'll tell you what to do. And lead healthy lifestyle. That's the complete
That's
package.
it.
Yeah, but I have patients even after 10 years, 15 years, they are coming to me. Even for small things, they will ask me. So we feel happy that we are connected. So we are always connected to my patients, not even 1 year, 10, 15 years, till you are in UAE, or if you're permanently retired, most welcome.
One question that people asked me when they knew that I'm going to be hosting you, is there someone who can execute the bariatric surgery more than once? Like he does it and then after 5 years he comes back to do it again. Is it possible to do it?
Yeah, it's possible. 5 to 10% failure rates is there due to lifestyle or other problem. Yes, we can offer you redo of bariatric surgery. One procedure is not very effective or failing or you are regaining weight, I can offer you another one to bring you back again normal. But it's not very big.
It's a rare case.
Yeah, it's a rare. 5 to 10% of patients might.
I see. Just to clarify one thing also that people ask about, the vitamins, the multivitamins, why do they have to take them lifetime? Is it the absorption of their stomach that becomes lower?
Yes, exactly. In bypass, more absorption problem. As I told you initially, malabsorption we set in. Because in intestines bypass. Yeah. So you absorb less. In sleep, it is less. But in sleep, the acid of the stomach or intrinsic factor, there is a factor from the cells, goes down.
Goes down.
So you don't absorb much B12 or maybe iron. So you have to supplement from the outside.
Are these surgeries possible for children or teenagers with severe overweight?
Yes, is possible if needed, of course. I have done also. But we are a bit careful about children. First, we put them onto diet and exercise programs, supervised programs, and then the dietitian takes care. And if we see that still nothing is happening, and I have patients, 13 years old, developing diabetes, even 150 kilos. So what we do, we send them to psychiatrist. Full psychoanalysis and psychologist support is there. And still, if that fails also, it's all documented. If that fails also, then as a last resort, we offer them bariatric surgery or non-surgical solutions. Yeah.
So there is a protocol before taking these children or teenagers to the surgery itself.
Exactly.
And what is the thing called minimally invasive in bariatric surgery? Can you explain to us?
Yeah, I do all minimal invasive. Means you don't make a big incision on the stomach. You make small holes from 0.5 centimeter to 1 centimeter. It may range from 3 to 5 holes. Through that holes, the instrument goes, telescope goes, and we look to the screen and see and operate.
And is it through laser or through what exactly?
We use laser also. We use electric instruments, which uses coagulation, cutting, those kind of things, yes.
Any success story that comes into your mind now that you'd like to share with us? I know you have many. It's one, like whatever comes into your mind now.
Plenty. I'm working in this field long time, so a lot of stories are there. But if I want to share with you, let's talk about 2 or 3 scenarios. Yeah. When I came here, we were telling, I used to do 70% of bypass. I thought that's most effective. But malabsorption and all, now 70-80% we do sleeve. There one patient came with gallstone. And he's a Canadian engineer from Abu Dhabi. This nuclear plant is there. I still remember, yeah. So he came for gallstone, and I saw he's obese. So I asked him that, Gallstone can be because of your obesity. So let's address obesity problem. And to my surprise, he told he takes 10 tablets a day. He was having diabetes, he was having hypertension, sleep apnea, and cholesterol and those kind of things. So I discussed and convinced him for gastric bypass. We did gastric bypass. Next week, when he came for follow-up, his wife came. And she was fighting with me that why for gallstone you convinced him for bypass. This is not good.
Okay.
And within 3 months, I smiled. I told, root cause is this, so just hold it on. So within 3 months, he was relieved from all diabetes, hypertension, weight became back to normal. Of course, gallstones I removed along with the bypass. And within 3 months, he was totally different, zero medication. And he still comes to me from Abu Dhabi to Dubai, zero medication. And later on, his wife was diabetic and she was after me, operate upon me, who was criticizing me. And of course, she was not overweight, so I couldn't operate to her. I couldn't offer surgery. But that's how the transformation happens. So that's a very interesting story from the same family.
So, which means that a lot of health problems could be solved through bariatric surgeries,
Exactly.
through weight loss.
Exactly.
You know, hypertension and different kinds of problems.
Yeah.
Dr. Girish, any other story also that you would like to share with our viewers today?
One interesting, there was one girl, of course, details we cannot tell. I did, again, gastric bypass for her, young girl, around 20 years. And I told her that her features were very good. So I told transformation will be great. And they didn't believe, especially the parents.
Okay.
After 1 year, I was just looking magazine. It was Arabic magazine. I saw the photograph. It looked just familiar. And I
Of the
asked,
girl herself?
yeah. And I asked my nurse, can you call this patient of us? She called, and to our pleasant surprise, she was the one who was obese, above, I think, 40 BMI, maybe
Wow.
100 plus. And I saw her within 1 year on the cover of one fashion magazine.
So she became like a model.
She became a model. So how the transformation happens. And she came to meet after that. Number two, there's a boy, one of my colleague working with me, cardiac surgeon, sorry. His son was 15 years old, obese, of course. And when he developed diabetes at this young age, the father panicked. And he came to me, Girish. And it was initial stages when we were teaching. People were not knowing much. Even the doctors were not knowing benefits of surgery, bariatric surgery. So he came to me and I told him I can reverse back to normal. So I operated upon that child. And later on, he went for studies to USA. And father told me, after 3 or 4 years, he told that he is captain of football team of his college.
Excellent.
You see that?
Yeah, excellent.
Oh,
These are real success stories.
We feel so happy when we see the transformation in my patients.
And this is a major transformation. Becoming a football player or becoming a model, it's a major thing.
Yeah.
You came back to the perfect weight.
Fitness, beauty, and reversal of diabetes, hypertension, healthy life. Your lifespan becomes healthy and long.
What is your advice to our viewers now, those who are overweight or have obesity problem?
I'll say to all the viewers, lead healthy life so that you need not to come to me, of course. But in case you are overweight or obese and developing health problems, come to us early stage. We can reverse a lot of things back, including the weight, and then lead your healthy, normal, active life so that you are away from all these problems which obesity brings. And to your surprise, every organ in the body gets affected with increase in weight. So be sensible, lead active lifestyle, and if you need our help, we are always present and at service for you.
Dr. Girish, I would like to thank you very much for sparing the time to be with us today and for answering all our questions. I really appreciate you spending this time with us discussing bariatric surgeries.
Same here. Thank you very much.
Thank you very much. Ladies and gentlemen, I hope you have enjoyed this podcast and I hope we have answered all your questions. In case you have more questions or you have an obesity problem, you can contact Dr. Girish on the number showing on the screen. He is available, as we said, at Gargash Hospital, at Swift Day Surgery, and Emirates Hospital in Jumeirah. Contact Dr. Girish and he is ready to answer all your questions and solve all your problems. See you in the next podcast. Bye.